Hi, my name is Sattler. I am a student nurse and I'm going to be walking you through a blood transfusion today. So, before I begin, I'm going to do some nice good hand hygiene. I have a bunch of supplies here and I will explain those further to you as we go along. I have done all of my math on this trusty little sheet and I have all of my papers ready to look over now. So, I'm going to start with my physician's order. I'm just going to quick compare it to the record of transfusion since this is what I'll be doing my checks on and I want to make sure I have the right patient. So geriatric, J-E-R-R-Y, atrique, A-T-R-A-Q-U-E, A-T-R-A-Q-U-E, VIN number 261, 261, 824, 824, 375, 375. Excuse me. I can see right here that we are going to be giving packed blood red cells. It's going to be 1 unit and it's going to be over 2 hours. So I see that I have the right patient, the right medication or blood fluid stuff. Sorry, the right blood, the right amount, the right dose, the right rate, and the right frequency. It's the correct time to give it. The patient's hemoglobin is below 68, so I want to be sure that I get this to him quite promptly. I'm also going to look into my helpful sheets here. I see the transfusion medicine results report, which also has more information, but since I've verified, I'm not going to worry about it. It was collected 2 days ago, so it hasn't yet expired, which is good. I also see that he has consented, he has signed, and there's been a witness to sign, and it still says that it's correct. So, seeing the physician's order, understanding all of the stuff here, I'm going to move on to my first check. Okay, so, actually I'm going to take this one out, I think that'll be more helpful. Alright, so I am going to grab my trusty secondary nurse. Leah here is not going to be able to talk it through, so I'll be doing it for her with this hand, which I'll say as more as we go. So I have the record transfusion against the patient demographics sheet for my first check. I see, I'm going to start by saying the name, geriatric, J-E-R-R-Y, atrique, A-T-R-A-Q-U-E, A-T-R-A-Q-U-E, wonderful, and I'm going to check the VIN number over here. Oh my goodness, I've lost it. Okay, the VIN number is right here. Wonderful, okay. 261, 824, 824, 375, 375. Okay, so that is all I need to grab from these. I do see that they were admitted with cholelithiasis, so I haven't double checked, but if I were this patient's nurse for longer than now, I would know the specific reason why he's having blood loss. It could be due to the cholelithiasis. So keeping that in mind, I'm going to be pushing this aside, and I'm going to be doing my second check with my nurse to help. She will be checking the blood tag, and I will be comparing it with the record of transfusion. So Jerry, J-E-R-R-Y, Jerry, J-E-R-R-Y, atrique, A-T-R-A-Q-U-E, atrique, A-T-R-A-Q-U-E, VIN number 261, 261, 824, 824, 375, 375. I am going to now check the patient's blood group. They both say A positive on here, or sorry, AB positive, so I know that the AB and the RH factor is positive, and I'm going to check that now with the component blood group. AB positive, AB positive. These are both the same types, so I know that this is going to be safe for the patient to be administered. I'm going to check the donation number now. C0510, C0510, 0808900900445, 445, wine a box, wonderful. I see on here that the cross match expires 3 days for specimen collection, and that isn't the time right now. Sorry, it hasn't yet expired, which I have verified. So that's good. I'm going to put this record of transfusion away. And now I am going to be holding this, and my nurse is going to be double checking over the blood. So before even doing that, I'm going to take a good look at the blood bag. And I can even have my second nurse check this as well. I don't see any streaking, any signs of clotting. The blood looks like it is safe to administer. This is an important check to make sure you aren't accidentally giving your patient bad blood. I also see that it hasn't expired today. So that is great. We're off to a great start. I don't need to check the name or the VIN number because that isn't going to be on this bag. That's why it has the label. But I will be checking the component blood group AB positive, and my second nurse will be AB RH positive, so that's good. And the donation number is C01 C01 C0510 C0510 0808 900 900 445 445 Y in a box, Y in a box. And this is packed red blood cells, it says right there, and that is what was supposed to be given from the physician's order. So the third check is done, and it looks like so far it's going really well. I could put have put the gloves on before even touching this, but since it hasn't been opened, I feel like it's safe to put the gloves on now. I'll be putting them on now to make sure that my hands are clean and that I don't accidentally get blood on myself, which could be a potential risk. So now that I have that done, I would normally prime my tube with normal saline before walking into the room, but since the metal pole is in the patient's room, I'm just going to go in there. I'm going to be bringing my white type blood set, my normal saline, my blood, my cumulative blood product record for all of my documentation, and I'm going to be bringing my little math cheat sheet. My second nurse will be joining me. So we've done hand hygiene. We walk in, introduce ourselves. Hi, my name is Alyssa. I'm a student nurse. I am here to give you blood. Before going any further, I'm going to be doing my fourth check just to make sure and get it out of the way. So hi, how are you doing? My second nurse is going to hold the blood and verify this while I'm asking the patient the rest of the information. So hi, can you state your full name for me and spell it? And he says out loud, Jerryatrique. My second nurse just checked over here. And I'm going to read aloud the FIN number, 261 261 824 824 375 375. Do you mind letting me know your date of birth or how old you are? And he says he's 52 years old, so we know that he's the correct patient. My fourth check was with the blood tag and the patient's wristband, so my fourth check is officially done. Yay. Now, as I'm doing part of my safety check, I make sure that the bed is at an appropriate height. It's a little higher right now for my own comfort, but normally after I leave, I would put it back down to an appropriate height. So I'm going to be checking the patient. He appears safe. He doesn't seem to be exhibiting any discomfort or signs aside from those he might show from being with low blood because his hemoglobin is below 68. So I'm going to be checking the patency of his line and making sure that there's no redness or swelling at the site. There isn't. I'm going to do one flush using aseptic technique. I'll be swabbing for 30 and letting it dry. And then I will make sure I'm not going to give him any air bubbles. And normally I would do the full 10, but because I don't want the mannequin to get over bloated, I'm just going to do that for now. So this will go in the garbage. And now I am going to, so I've ensured the patency of the line, I'm going to start getting this blood ready and I need to go. No, I'm not. I'm going to just finish up my last rites with my patient. I'm going to let him know, just make sure he has signed a consent, but I want to make sure that he is still consenting. I'm going to make sure that he understands the potential risks, the reason for it because of his low hemoglobin. I'm going to make sure that he understands that I will be doing a vitals check with him just before the transfusion starts, 15 minutes afterwards, every hour of the transfusion, as soon as the transfusion is done, and an hour after the transfusion is done. I'm going to explain to him that the first 15 minutes, I'm going to be, when the blood is going, I'm going to have this running at 50 mils an hour, and I will be with him the entire time to make sure that he isn't showing any signs of an allergic reaction, like swelling, itching, any rashes, any shortness of breath, or any changes in his vital signs. I'll be keeping a close eye on him just to make sure of that. I've told him all of this and he understands, so I'm going to start priming my tubing now that I've given my patient all of the information. And I'm using a Y-type blood solution set which has a lot of fun clamps, and I'll be making sure that these clamps are all put appropriately. Normally I would hang this, but they will leak all over you, so I'm just going to do the first one right here, making sure that the top of this stays sterile. The bottom of this stays sterile. Alright, and I'm going to make sure these are both clamped to start and not right at the top because that wouldn't be a proper clamp. Okay, and now I'm going to tap the bottom one as well and make sure that I get this done. So I'm going to let the normal saline run through, and I'm going to fill this chamber with normal saline up to past the filter.
10 minutes have passed.
Wonderful. So past the filter to make sure that when the blood comes through here, it's not going to get damaged by hitting a dry filter that can potentially lyse it, which is very bad. So the water is between, the normal saline is between there. So the chamber has been primed, and I'm going to prime the rest of my line just into the garbage bag here. Alright, I'm going to lock this. Check the tube for any air bubbles, and I don't see any air bubbles, so this has been primed with normal saline. Now that I've done that, I'm going to clamp this. The bottom has been clamped, and I'm going to put my blood bag in there. I'm going to wing this back. Remove the cap, make sure nothing touches that. I want this to keep as sterile as possible. And keeping this tip sterile, I'm going to shove this in. Oh, lovely. Okay. Okay, the blood is good. Now I'm going to prime the line with the packed red blood cells, which, also keeping in mind, for the sake of demo, it's a lot more difficult to see that the red blood has gone through. I'm going to double check that's been clamped. I don't want blood. Okay, sorry. It was just a little high. But the blood didn't have any time to go through. Okay, we're good. So this has been clamped. That is not clamped. And the blood is going to start running through. So like I was saying, so for the sake of demo purposes, it's really difficult to tell when this very pale blood comes through, but I'll be watching. Normally you would be able to see a clear line of the blood trailing through the normal saline, and you would know exactly when to stop. I'm going to stop it when it's right up to here, which is difficult to see. But for the sake of the demo, let's say that I can see the blood all the way up to the tip without letting any blood leak through, because then my patient wouldn't get the full 358 mils. So my line has been primed. I'm just going to make sure everything's clamped right now. I'm going to put this to the side. I see before giving my patient that emergency saline is here. That is part of my safety check, is to make sure that that is not only there but primed, which there are a couple of air bubbles, but normally there wouldn't be any air bubbles. I would get those out and make sure that my line has been safely primed. And now I'm going to start programming my pump. It is going to be running at 50 mils an hour for the first 15 minutes. Afterwards, I will be changing it to 197, which I don't know if you checked out the math, but I have my math written down. Okay, so just to make sure that it runs for that full 2 hours. So 50 mils. And then right now it has 358. I'm going to change the mode to label my line. I'm going to put it at red blood cells, select red blood cells. I'm going to open this up and as you can see, it's been labeled. So I might have my second nurse come in and verify that everything is looking good. That's just for my own comfort as well. So the red blood cells are all ready to go. This has been entirely prepped. I've done my 4 rights. I have my emergency normal saline at the bedside. So now I can confirm that. And I am going to clean this again for 30 seconds, let it dry. And using a septic technique, I'm not going to touch that or this line. I'm going to unclamp all of my lines. I'm going to make sure that my normal saline is still clamped and that my red blood cells are clamped. So just one more time, checking through. Unclamped, unclamped. All right, and I'm going to start. I'm going to check for the 3 drips to ensure that my transfusion is working. And I'll be staying with the patient for the first 15 minutes, changing it to 197 like I said before. I am going to now have my second nurse co-sign this sheet with me, the cumulative CBPR. Date, time, consent, blood product, donation number, all of the vitals that we'll be doing will be on here. And we will be initialing over here. So I have done in the 15 minutes I would change it. I would do an exit safety check and I would keep a continuous eye on.
Okay, so for this,